Will that pain wear off, or is it time to see your doctor or even call an ambulance? Around 11% of men and 9% of women in the UK have been diagnosed with some form of heart or circulatory disease. But what symptoms can we look out for that might indicate a potential heart problem? Let's talk about some of these signs that could mean it's time to see a doctor. 1. Stomach pain or indigestion. An indigestion-type pain or a burning sensation in your chest or stomach can be a sign of a heart attack or related heart problem. Because the heart, the gullet, and the stomach are all lying right next to each other, the challenge, for both members of the public and doctors, is that a burning or indigestion-type pain and heart pain can be difficult to disentangle. 2. You feel dizzy or lightheaded. A lot of things can make you lose your balance or feel faint for a moment. Maybe you didn't have enough to eat or drink, or you stood up too fast. But if you suddenly feel unsteady and you also have chest discomfort or shortness of breath, call a doctor right away. 4. Feeling sweaty. Working up a sweat when you've been to the gym or because it's a really hot day is nothing to worry about. But feeling hot and clammy along with chest pains is a sign that you should call an ambulance. 5. Leg pain. If you get a gripping, cramping sensation in your calves when you are walking, it might be worth seeing your doctor, as that can be a marker of peripheral arterial disease. It's most common in smokers and people who have diabetes. Make an appointment with your GP. 6. Arm pain. You might not associate arm pain with your heart, but it can be a sign of a heart attack. If your pain is going down the arm, especially the left arm, or into the neck, that makes it more likely to be heart-related than indigestion. If it doesn't go away, you should be seeking emergency medical advice. 7. Jaw or back pain. With heart attacks, it can even happen that the pain is felt in the jaw or the back. There is some evidence that women's symptoms are more likely to vary from classic chest pain, feeling sick. Obviously, not every bout of nausea equals a heart attack, but if you're getting pain as well, alarm bells should ring. If you experience intense chest pain even when you are just sitting around doing nothing and you are also feeling sick, that is the time to call for an ambulance. 8. Swollen ankles. This shouldn't be ignored, especially if the ankles get really big, as it can be a marker of heart failure, but it is also very common and has lots of other causes. It could just as easily be from tablets you are taking. For example, blood pressure medication can lead to swollen ankles. If you're getting swollen ankles, it's worth making an appointment with your GP. 9. Irregular heartbeat. This is a hot topic at the moment. There's a lot of focus on diagnosing irregular heartbeats. Being aware of your own heartbeat is really quite common and in itself nothing to get anxious about. If your heart is going very fast and jumping around erratically, then that's when you should see your GP. If you feel like this and then you experience blackouts, call an ambulance.